We're all aware of the impact COVID-19 has had on other nations. China and Italy offer vivid examples of how swiftly the virus can spread. The hospitals in some areas of these countries were quickly overwhelmed. In the short history of this pandemic, we've already learned a lot about the nature of this virus and how we transmit it. One is that we can all spread this virus before we know we have it, before we have symptoms. That changes everything. The steps we need to take are very much different than simply avoiding people with symptoms. Even though our researchers here and across the nation are working as quickly as possible, we don't have a vaccine or an effective treatment. And we don't expect to have one over the next few weeks when the Nashville area will experience its peak in numbers of cases. So, our most powerful tool now is to slow the spread of this virus. Our most powerful tool to slow the spread of this virus is social distancing. That includes sheltering at home for people not working in essential service areas that the mayor has outlined. We do know this works. The evidence is clear from countries with outbreaks ahead of ours. And if we do this and we take it seriously, we will lower the pace at which people become infected. In healthcare, we call this flattening the curve. By following this public health order, we can reduce the number of people who need to be in hospitals all at the same time. We need your help to reduce the extent to which Nashville's hospitals are overwhelmed. We need your help to preserve precious healthcare resources to care for those who we know will require intensive care support for COVID-19. And we need your help to preserve healthcare resources for thousands who will, at the same time, need our hospitals for so many other conditions, like heart disease and cancer. Those diseases are not declining just because coronavirus is increasing. Yesterday at Vanderbilt, we had our first patient die from COVID-19. Vanderbilt University Medical Center strongly supports the mayor's statement and the plans he announced today. I can also say that the leadership of Metropolitan Nashville's other healthcare systems, St. Thomas Ascension, Nashville General Hospital, and Meharry Medical School, and many others represented by the Tennessee Hospital Association, are with us and support these moves. Thank you, and I'll now introduce President and CEO of Meharry Medical College, Dr. James Hildreth.
Good morning. Mayor Cooper asked me to speak this morning regarding the science that underpins his decision to impose the new restrictions. This virus belongs to a family of viruses that have a very high infectivity rate. The data shows that for every person who's infected by the virus, they infect on average 3 other individuals, which means that every 6 days, the number of people who have this virus could double unless we do something to stop it. As you heard from Dr. Balzer, we have no vaccine, no effective drug. The only tool we have in our quiver to fight the virus is to stop the chain of transmission. And that means, in this case, social distancing and hygienic practices that limit the contact with the virus. This virus can be transmitted through aerosols, and that's why we need to stand 6 feet away from each other. That's the social distancing. We also know the virus can live on surfaces for as much as a whole day. That includes plastics, paper, cardboard, wood surfaces. So we have to be mindful of our T-zone. All of us have a habit of touching our faces several times a day. In fact, some people do it several times each hour. And the T-zone refers to our eyes, the nose, and the mouth. These are the surfaces by which the virus can be easily transmitted. So when you touch a surface that's contaminated and touch your T-zone, you can, in fact, infect yourself with the virus. So by social distancing and by practicing these techniques of protecting our T-zone, we can limit the transmission of the virus. People need to understand that we've not dealt with a virus quite like this since 1918. An extraordinary virus like this requires extraordinary measures to stop it. So I fully support the mayor's decision to shut down the city for 14 days or to take these steps.